Ever open a Med-Surg chapter, see all the bolded terms and feel lost before reading the first line? I've been there. Hi friends, I'm Nurse Mia and welcome back to the Gets Zen RN Study Group. This part 1 of the chapter, Key Terms Made Simple. That's exactly why we start here, because those terms make the rest of the chapter finally make sense. Key terms are just a small part of the work, but they unlock the rest. If you learn term first, the rest becomes easier to absorb. Those words are the foundation. Without them, you'll read the whole chapter as a guesswork. Most chapters start with 10, 40 terms, and each one connects at least one clinical pathway: lab, symptoms, nursing intervention, diagnostics. These are just test words. They show up in NCLEX terms, in nursing reports, and real patient conversation. Imagine your patient says, "Nurse, the doctor said my atrial fibrillation is causing hypertension and it might be from polypharmacy. What does that mean?" You will need a language not just to understand it, but to explain it with confidence. Let's break it down term by term, Q by Q, calm and clear. Let's get started. Chapter 21, we have about 24 terms. So it's about multi-resistant organism infection disorder. And the first one is Acinetobacter baumannii, a gram-negative bacterium that thrives in hospital settings. Known for antibiotic resistance and causing pneumonia, blood storm, and wound infection. So think about baumannii. So it's like it's for antibiotic resistant in ICU bug, not bag. Sorry. Then the next one, we have the airborne transmission, made of transmission where pathogen travel through air, like TB, measles, COVID-19. So air, think about air, floating germs, think of sneezing or coughing. Think air floats far, wear N95 mask for airborne precaution. And this is like definitely for finals, it's for NCLEX. Bactericidal, it's an agent that kills bacteria directly. So the suffix cidal, think about suicidal to bacteria, it kills them. Bacteriostatic, it's an agent that inhibits bacterial growth without killing them. So the suffix static, it's like static growth, stop growth but doesn't kill. Carbapenem-resistant, it's enteric bacteria that are resistant to carbapenem antibiotics, difficult to treat. So it's so this actually they are both together. Carbapenem-resistant Enterobacteriaceae, so CRE, So this enteric bacteria resistant but highly mortality rate. So the CRE, think about critical resistant enteric. It's just kind of a way to remember, and needs isolation. Here, looks like my I have a glitch on this Excel form. The coagulase positive bacterium, this bacteria likes the Staphylococcus aureus, so the staph that test positive for coagulase enzyme, and this Staph aureus producing coagulase enzyme and linked to virulence. So the coagulase, think about clotting, more virulent bacteria, and it's positive. So the staph, it's a positive gram bacterium, and positive, it's the pathogenic staph. Think like a sticky staph clumping blood. Then the next one is a C. diff. Again, this looks like that combined here. This C. diff is a store-forming bacterium causing severe diarrhea and colitis, often after antibiotics. So a lot of antibiotics. This is the concern side effect. So bacteria cause severe diarrhea. So C. diff, it's the colon diarrhea difficulty. So next, colonized. So it's kind of a little bit repetitive here. Presence of organism in a person without signs of infection. So colonized is a silent carrier. Germs are there, but not yet symptoms, but still contagious. And getting a little bit down the and here we have the contact isolation. Isolation precaution require a gown and glove for patient contact. Precaution to prevent the spread by direct or indirect contact. So contact, it's touch. So everything, what that means, it's a gown plus gloves, and gowns and gloves before entry. Thing touching, it spreads. To block, you need to block the spread. Here we have contact transmission. Transmission through direct or indirect contact, hand surfaces, touch, and past contact transmission by hands or surfaces. Here, endogenous pathogen. It's a pathogen that originates from the host's own body, like good gut flora, and this infection from the patient is from the patient own flora. So think about endo means inside source, like gut bugs and might causing UTI. Exogenous, exo, think about outside attacker, like food, dirt, animals. So this source of infection from the external environment, so soil, food, infection from outside the body. The next is facultatively anaerobic. It's an organism that can grow with or without oxygen. So this bacteria can grow with or without oxygen. So flexible oxygen user, it's the facultative anaerobe. So the flexible flora, they can switch between O2 and no O2. O2 is the oxygen. We have the hand hygiene. It's an essential infection control step to prevent the spread of pathogens. The most effective method to prevent the infection spread. So clean hands, clean care, first defense, always hand hygiene save lives, always before and after patient care. We have again to here down. So the methicillin-resistant Staphylococcus aureus, MRSA, we call it, the strain of staph resistant to methicillin and other antibiotics. Staph is resistant to beta-lactam antibiotics. So MRSA means the mean resistant staph attacker, most resistant staph around. Use contact isolation for this. Again, multi-resistant organism, bacteria resistant to multiple antimicrobials, require strict precautions. So multiple drug refuse organisms. So it's a superbug, hard to treat. It's a very high priority. And non-sporulating, it's a bacteria that do not form spores, are less resilient in harsh environments. So no spores, it's less durable in the environment. Nosocomial infection, it's a hospital-acquired infection not present at admission, infection acquired in healthcare settings. So it's a hospital harm, it's a nosocomial infection. The peak levels, it's the highest serum concentration of a drug after administration. So peak means top level after giving a drug. So watch for toxicity here. Probiotics. So the probiotics leaves organisms that restore gut flora and may benefit the gut health and induce infection like C. diff. So the probiotic means pro-health biotic, gut protectors. So give after antibiotics. Through level, the lowest serum concentration of a drug before the next dose. So through, I think might be a valley before the next dose. Watch for effectiveness. And then Vancomycin-resistant Enterococci. So the strain of Enterococci resistant to vancomycin, major cause in hospital infection. So it's a shortcut from vancomycin, and also needs like strict isolation. We are almost there to the finish line. vector-borne transmission. It's via insects or animals, mosquitoes with malaria, for instance. So this is the vector, it's spread by insects. And I said malaria, Zika, so I'm gonna repeat it here. So the vector means like the vermin or bugs that carries germs. And vehicle of transmission, it's transmission through contaminated items. So this spreads is like from food, water, blood. So vehicle of transmission, think vehicle as a delivery car for germs. So this vehicle carries diseases through. And now it's end of the chapter. I hope this little chat of key terms will help you to understand better the chapter. Checking out, and I'm telling you my last thanks and goodbyes. Thank you so much for being here with me today. I hope this video helped make things feel a little clearer and less overwhelming. If this supported your learning, please give it a like or share it with your fellow nursing student who might need this too. Everything we cover connects back to the real nursing, wherever it's recognizing a lab, planning safe care, or knowing what to teach a patient. Let me know in the comments below, what was the most helpful thing you learned today? What still feels unclear or confusing? If this was what you hoped, and make it easy for you. If you can also let me know if you like the notes for this chapter. Check the description. I usually add some free resources there just for you. Thank you again for your time and trust. I'm Nurse Mia, and from my heart to yours, until next time, stay zen, stay grounded. Namaste. Bye for now.